Breast cancer can affect anyone of any age, and it's not only older women who are impacted by this dreadful disease. Here now to tell us more about breast cancer awareness in younger women and even men is Dr. Nancy Bednarz, radiation oncologist at Baylor Scott & White McClinton Cancer Center. Thanks for spending some time with us today. So we're wrapping up this month of awareness, and to me the best part about it is that it's making women aware they need to go get a mammogram.
Yes. So, women, generally speaking, have always kind of felt like, and also practitioners, because that's what we were taught in medical school, that breast cancer often hits the 50 to 60 to 70-year-old age group. But in the years that I've been in practice, it seems that women are getting much younger whenever they come in for presentation, and it's not unusual anymore for us to see women in their early 30s and even 20s being diagnosed with breast cancer.
And that is just so puzzling. What is research showing? I mean, you hear things like aluminum in aerosol, you even say, oh, don't, tuck your cell phone in your bra, because there could be some sort of something like that, but nothing really has.
I think there's a lot of discussion about different environmental factors, the ones that you mentioned, along with, pesticides and herbicides, something that is in our food, hormonal exposure at a younger age, air quality, but there's a lot of suspicions out there, but there's nothing definitive that we can put our finger on. But certainly women are presenting much younger with breast cancer diagnosis.
So are they finding it through self-exam? Because it's not recommended that particularly young women go get a first baseline mammogram, or are they going to start moving that further down?
Well, right now the American Cancer Society recommends that women of average risk go in for your first mammogram at 40.
So what is average risk?
So average risk is 1 in 8 women in their lifetime are going to develop breast cancer. As long as you don't have a family history of breast cancer, then you're considered to be average risk. But if you do have a family history, then we're recommending going in about 5 years earlier, so at about 35.
35, yes, mid-30s. But still, the self-exam, even...
Absolutely.
So how young and would you recommend?
So, even in your 20s, I think, women need to be aware of what is normal for their breasts. They're all shaped a little bit different. They all feel different as far as density. And I think a lot of times women feel something abnormal in their breast and they go in for an evaluation and it's attributed to change in hormones or caffeine consumption. But nowadays we're feeling like that's risky to not go in and have it evaluated, by an ultrasound, which is, non-invasive, it's easy, you're not exposed to any radiation, but an ultrasound really is an excellent tool to give us information about if it looks malignant or if it really is benign.
So how can folks get in touch with you? Maybe schedule that mammogram.
Right. So, the primary care physicians, OBGYNs, they really are on the front lines of breast cancer care. We're sort of tertiary, after the diagnosis has been made. But your primary care physician or your OBGYN can order that ultrasound.
All right. Thank you so much.
You are so welcome.
Appreciate you being with us today.
Absolutely.